Good morning, everybody. It is February 12th, the Board of Health meeting at the Town Hall in Room 12 at 10 a.m. First order of business is the approval of minutes, but before I do that, I have to tell you that this meeting is televised. We have to say that by law. Okay, now we can do the approval of the minutes.
I make a motion to approve the
I
minutes.
second that.
Okay, all in favor?
Aye.
Okay, carried. Second order of business is, new business is vaping e-cigarettes information.
Oh, I need this information. This is bothering me more and more.
Yeah, the more you hear on the TV, the
Well,
worse
I
it gets.
hear that it's very active in the schools now.
Yeah, so off our last meeting, I included, and then actually I got an email yesterday and I added it to your
Yes.
packet with some more information from the CDC about nationwide trends, which are just the same trends we're seeing in Norwood, the same trends we're seeing in the state. There's an increased use in nicotine delivery products or e-cigarettes. We have seen major declines in tobacco products, but a huge increase in the nicotine delivery products. This board has been very progressive and preventative with our regulations. As you can see from the information provided, a lot of the marketing towards kids is the flavored products, which, if you remember, we are, I think, into our second year of no flavor
Banning.
products.
Yeah.
There is a trend now, and a couple towns have done it, to include, so there was always an exemption for mint and menthol products because of some court cases that had happened in other states and communities that had banned
What's it
flavored.
called, excuse me?
Mint and menthol products.
Mint and menthol.
So you can
Mint
grab the
and
Newport
menthol,
cigarettes
yeah.
Okay.
and any mint
Flavor.
e-cigarettes, any
Flavored,
mint
yeah.
flavor. Anything that wintergreen, mint,
Okay.
spearmint, all those were
Yeah.
still allowed, but like the watermelon, the cucumber,
Oh,
the
those-
bubble gum were all banned. So the Somerville was first, and then Needham went, and they included mint in their flavor bans. They are all facing Somerville, I believe, just got their notice of being sued. Needham is waiting for theirs from the tobacco companies that manufacture these products. And I believe Ashland has also gone ahead and included the mint ban. I would like to see how the court cases go
Before
before we
we,
set the
Suing
town
who?
up to be sued. The
tobacco
manufacturers are
companies,
are suing the communities,
Yeah.
which they expected, and they knew, and they had, talked with counsel, and before they did that, they knew they would prepare for a legal battle. A lot of this, I think we wait and we see what the legal battle comes out with. And then if they're successful, I would recommend this board to take a look at it.
Okay.
Of banning the mint and
well, there's
menthol.
a difference between mint and menthol. I think menthol is a whole different ballgame than mint, so,
Any sort of mint product is still allowed.
Yeah.
yeah, okay.
So wintergreen, spearmint, others are still
That's,
allowed.
I think if we ban not right now, wait until the court cases, but I think if we ban the mint, it's different than the menthol. The menthol is a whole different puppy, I think. I don't know.
I think
Because menthol used to correlate with cigarettes, Joni.
Right,
Yeah.
right.
And I thought menthol made you that lightheadedness too, when you inhaled. When I took a drag of a menthol cigarette, I don't know, does that have any?
It's just a flavoring put in the tobacco to make
Okay,
it smoother and
okay.
easier to
Okay.
inhale.
Yeah.
So there's no real reason for it to be in there except for a flavor.
So can I
Probably
ask,
not that good for your lungs because
No.
the more menthol you have,
so
the more
dummy,
it's gonna open up things.
dummy me in a lot of the people that are watching this. When you vape, you're vaping tobacco.
Right.
No.
Well, it's
No.
a,
Okay,
no, it's
so
a, it's
this is what so many people ask me, and I don't know the correct answer for that. So when the kids, they say, are vaping in the junior high, what are they vaping that the smell is not permeating the room or the exterior as part of that school, coming out of the bathrooms? What are they vaping, cigars?
So it's vapor. It's a liquid that they put inside a device, or some devices come with pods that already have the substance in it.
In what?
And then there's a battery in it, and they heat it up and then inhale the vapor, which usually has nicotine in it.
Nicotine, yeah.
And it's not regulated, so you'll see, it might say nicotine free, but then they've been studies and they've tested and it's not nicotine free. And one vape pen is like a pack of cigarettes. So the amount of nicotine and the level of addiction we're seeing, because nicotine is the addictive product of a cigarette, of any of these products. So we're seeing a high level of addiction in youth based on these e-cigarette
So
products.
is there smoke, some kind of substance coming out of a vaping when they're vaping in school?
It's vapor.
Right,
It's
it almost
steam.
looks like steam.
it's like steam.
Okay, so it's steam.
Yeah.
And does
Some-
that have a scent?
So unfortunately, even though we've banned it, it is widely available on the internet, and anybody
what I
with a
was
credit card can order something on the internet. And we also talk not only, you think your youth might not have credit cards, but they might have Visa gift cards anything like that,
Or
then they can
debit
order something
cards,
on the
bank
internet.
debit cards, yeah.
So what you'll see is, one child will have the money and then sell them in school. So there is still, unfortunately, access to it, even though there isn't access in our retail stores in Norwood.
So they're still ingesting nicotine, which
So
is,
they,
Yes.
adjusting the
By
nicotine drug.
It's not, you wouldn't call it smoke, steam.
so I wonder, I thought that they weren't inhaling, excuse me, nicotine.
They are
Yeah, they
inhaling
are.
nicotine.
So
They
vaping
are
is
still
only with the nicotine. You can't do it for pleasure, like just, I don't know. Oh, I don't know.
Well,
Well,
they
some people
advertise-
use it for marijuana.
Yeah.
Some people put, the CBD oils in it, the certain types that you can put in a vaping pipe that you can use. Some people use it for that.
So these kids at the high school and junior high aren't doing it. They're doing it for the,
No, there are, you can go and find a YouTube video on how to alter your vaping product to put marijuana oils into it.
Yeah.
and
to
as
vape
I've read
that.
online, every community is fighting this battle, not
Correct.
Oh,
just
yeah,
us.
for sure.
Every middle school is fighting this battle with us.
Well, just in looking at the news thing that Segal gave us, I mean, how sad is it that 7.7% of the kids are smoking cigarettes and 23.7 are vaping with the e-cigarettes?
I mean, I talked to
It
several
just-
youth, and they don't even go in the bathrooms anymore.
Yeah.
At the junior high, I mean,
Yeah.
I just don't get it.
Yeah.
But
It's sad. I mean,
that's why we are gonna stay very on top of this,
Yeah.
Gal, thank you.
Yep. So, and just what Joan was citing there, so a quarter of youth report current use of e-cigarettes, which means, regular use within the past 30 days. The chart below is if they've ever tried it. So about 45% have ever used one. But a quarter of them are using it on a regular basis, that's current use. So is very startling. And
Yeah.
we'll see, our data should be coming out in the next couple of months about Norwood-specific use rates with the Youth Risk Behavior Survey
Yep.
that we funded through the grant in the schools. That'll be coming out and we'll be able to see, because our data is now 3 years old, so we're gonna be able to see whether things went up, down, or stayed the same.
that's,
It's great.
God, there's so many things you have to watch out for when you have young teenagers in your family. It
Scott, can I
just,
ask
So
another
is
question?
vaping not allowed in the schools?
no,
No.
Okay.
no.
And what I liked about these handouts is the pictures of them, because a lot of them will look like,
Yeah, fancy.
they look like USB ports.
Yeah.
So a lot of people don't know what they are.
Yeah.
And if parents don't know what to look for, then
Is this
they
them
don't
you're
have
talking about?
any idea.
Yeah, those are more the older kind. If you look here, this black one is a Jewel, and which
Yeah.
is really the most popular brand.
It's like that, see, on this
this
page
is
here.
Yeah.
They look like USB ports.
Yeah.
See, just like that.
That's something you vape?
Yep,
That's the top. Yeah.
that's the top.
You
And
take
then
that
you can
off
charge
and
the
put
battery in
I would try to look like I would wanna put it in a computer.
Exactly.
and that's how you charge it, by putting it in a USB.
Yeah, exactly. That's exactly.
Question, excuse me, ladies. Tara Noyes, who left our school system, she was very active in this and helping us with all our surveys. And has anybody replaced her that has stepped in to help us?
Yes.
Please, her name.
I apologize. This is the third time I forgot
Okay,
his
so
name.
we haven't laxed, there hasn't been a
No.
lapse
Nope.
in that,
No,
thank
he's actually
you.
come several times to meet with Aubrey, and actually Aubrey's not at this meeting because she's at the high school speaking to classrooms
Good.
about Impact
Good.
Norwood and the work they're doing.
Good.
We're doing a push this year to really recruit youth into the program, because we can't be successful in targeting youth without talking to youth.
Right.
Good, so we have somebody in place at the high school,
Yes.
thank you.
But
I
the
apologize,
basic
I
line
don't
is
remember
that
his name.
e-cigarettes are not safe for youth, young adults, pregnant women, or adults who not currently use tobacco products. So it's not safe no matter what you do, or no matter who you are. So, it's still nicotine. And
But if you remember when the pediatrician was here talking about us
was
bringing
amazing.
the age to 21,
yeah,
he said that the child brain, if you can get them to not do these products before the age of 23, then they hopefully will not become addicted.
He was
So-
wonderful, Kathy, with
you
his
know,
insight. He's done
and-
so much.
But these kids in the junior high and the high school, so if we can't get them to stop using it now, they'll be addicted to it. Yeah.
I thought it was 25.
No, he said 23.
Did he say
23. Their brain is mature enough to hopefully not have addictive properties to it, he said.
Wow. More than 1 in 4
What
high
was his
school
name?
students,
Pediatrician?
wow.
Dr. Hartman.
And
Yes.
1 in
Sorry, I couldn't
14
remember
middle
his
school.
name.
Wow. That's sad, that's,
Does-
CDC has a good,
Aubrey, go down to the junior high level and talk to those, talk to the students there as well.
Yeah, and again, the data would be the driving force on
Thank
what
you.
programs we target.
Can family members, can people get this on the CDC website? Could they get this?
Yeah, we can also share it on social media.
Yeah,
Like I said, I
right.
just got that the other day.
Yeah, because this is a very good overview, and it tells what the
yeah.
schools can do, what the states and the communities can do, and if they can, it's on their website, it says, on cdc.gov, so if people are interested, it's probably not a bad thing for
I don't think
to
people
look at.
understand that 1 jewel pod equals a pack of
Pack of
cigarettes.
cigarettes.
I
No,
don't think
that's to
people
me, too.
understand that. That's scary. It really is. That's scary. How many puffs do you get out of a jewel pod?
That's a good question.
I have no idea.
That would be a question I would,
Something also from a public health standpoint I found interesting was they're sharing the products a lot. So they'll, Carolyn's example of in the bathroom, and they'll pass it around the bathroom, and they actually connected a mono outbreak. to
Oh,
Jewel.
yeah, yeah.
I did.
Wow, yeah, I could see
They're all
that.
just sharing in the mouthpiece.
wow.
So
Gross.
goes way beyond just substance use prevention.
So hard to get a grasp on this, but we have to
Yeah,
start
that
somewhere, and
should-
we've started to be very active in it, so.
There's so many scary
Thank you,
things, and
Sita.
now with the measles outbreak, what do they say, 50 people now have the measles?
Yes, we have been tracking that, keeping aware of it. We do have much higher vaccination rates in this area.
Well, that's good.
But we are definitely, you have babies that can't get vaccinated, people that can't get vaccinated for medical and religious reasons, so you always want to be aware of something like a measles outbreak and
Yeah,
only a flight away.
and the mumps, I guess the mumps are coming back too. I heard on a health report not too long ago that they had several cases of the mumps going around, so, adult mumps.
Yeah, as vaccination rates go down, because of really a lot of misinformation, we will see diseases come back for sure.
Yeah. As long as it's not smallpox, anything else we can,
Well, we'll get you the horse and
Kinda.
buggy.
yeah. Okay,
We are proactive, so Carl, thank you
all right,
for everything you did.
yeah, okay, we're gonna talk about the pajama, golf for the, annual Bruins PJ Drive, February 1st through March 15th at the Moore Memorial Library, and, is that no, there's,
No, it's all
location
around
at,
town.
all around town at Memorial Hall and, is it
The library.
the library,
The rec center.
yeah,
Every school has
Every
a donation
school.
box.
Yeah.
okay.
Yeah.
And, they're looking for, you to donate a pair of new pajamas for kids in foster care and help the library reach its goal of 400 pairs. So, that's great. All PJs will be distributed to children in need by Cradles to Crayons and the Department of Children and Families. So, that's great.
And they don't want, because my husband is involved in pushing this forward, so, they don't want themed type pajamas, like,
You know what,
they don't want
Themed.
themed, like Christmas, Valentine's
okay, very
Day.
good.
They can be, the kids' things like Star Wars and stuff like that, but they don't want any ones that are specific to like Valentine's Day,
Holiday themes.
holiday
Yeah.
themes, right, so. But it's moving pretty
It's
good.
moving pretty
Yeah,
good.
we
They've gotten
have,
quite a,
they have quite a bunch already.
Good.
I don't know what the count is, but I know that it's moving.
So I think we need to address the competition going on.
Yes,
What-
there
what
is
is
a
it? What is it?
competition. There's a competition between the town of Bourne
Oh,
on
yes,
the
that
Cape and Norwood. Because Bourne has won it the last 4 years in a row, and they wanna
Oh, they wa-
win again. And Norwood came in second last year, so the push is on to beat Bourne.
Yes,
Oh.
well, Tony upped the ante, and Paul, actually at the school level,
Yep,
came home and got the letters, and the school that collects the most gets free ice
gets
cream
an ice
social
cream,
party.
yeah.
I heard if you
Nice.
donate at the fire station, and it's the little police versus fire competition, they said this morning that you get a raffle ticket for a free,
Fire engine
truck
ride to
ride.
to
Oh,
school, you know
wow,
how important that is for a
yep,
child, oh my
Yeah.
God.
Oh, wow.
So those are the things that
Ice
are
cream
going,
and
there's a lot of competitions going on. There's been challenges already with the selectmen, between selectmen to each up the ante between themselves.
themselves.
So, you know,
Board of Health might have to do something.
yeah.
Good healthy competition is what I'm all about, I love
Yeah.
it.
Yeah.
I mean,
No.
it's for a very good, it's
inspection.
for a very good cause, and my husband will tell you it's not just about the contest, but it's making sure that kids
Yeah.
have warm pajamas. We
Yes.
don't think about it because we know our kids have warm pajamas, but there's a lot of people.
And these are
out there.
going out of the community, right?
Yes,
Yes.
yep,
That's awesome.
Thank you.
That is awesome.
yeah. It's very heavily underway, so.
Good. Well, we're gonna get
He
more than
just got
400 kids.
notification that the high school and the junior high school are on board this morning. All of the elementary schools are on
Oh,
board.
nice. Oh, that's
So-
nice.
St. Catherine's too.
St. Catherine's
St.
too,
Catherine's
yeah.
too.
So they're all competing for that ice cream party. They said to me, you better save your pennies because you're gonna be buying a lot of ice cream.
Yeah.
Yeah, yeah.
Same.
Oh, that's good.
Yeah.
That's really good.
Yeah.
Like you said, good, healthy competition.
Yeah,
for
we go
something.
from vaping to
Yeah.
pajamas for kids, I'd rather do
Yeah.
pajamas for kids.
Yeah.
I
Well, we
know.
can do a challenge.
Yeah,
Yeah,
go ahead,
We
next
can
one.
challenge other
Okay.
departments in the town hall. To see who donates, so did I, but that's
I
okay.
don't think I'm like I donated mine.
yeah. Jeez. Okay, let's move on to the annual report. I just had a couple of things that we talked about, and one of them was just changing a word and something else.
And I have a question, and I'm gonna jump the chairman. Is this for, because this is in front of us right now, is this because of the override? So what,
No.
has this been done?
We do this every year.
Okay, I
In
just
the
didn't know
town-
if
in the
everybody
town
wants
book.
to see what we do and how we do it.
Yeah, it's for the annual report, the booklet that the town produces
Yeah,
every year,
okay.
that's at town meeting, and
Yeah.
there's always a stack outside our office too.
Okay.
Because I knew
So
that we
you've
have
got
to
the
cut
changes.
Yep.
some cuts to our department.
Were they just spelling
No, these
changes?
don't reflect any.
No,
Yeah,
we-
it says we would like to extend your,
Oh.
our gratitude,
Now I'll tell you why.
and then the number of tobacco licenses we're
Um,
gonna talk about.
The major change was we integrated animal control into our annual report. It happened
Yeah.
halfway through the year, but I just thought it made sense to include it in here.
Yeah.
I did, most of it is the same, just updated numbers. We did sort of tweak the organization of it a little bit. But it's a good sort of assessment of everything we do here.
Yep.
I do try to be short and sweet with it, but we still end up with, what, 5 pages?
No,
I'm very proud of what we do here. This is
Yes.
amazing.
Well, it
when I-
does, you know, it does
we do a
support why we're here too, and it, you know, because sometimes I'm sure there's people out there that think we don't do,
yeah,
that we're not busy enough. But when you look at inspections, you know, 941 permits and licenses, that means somebody has to look at all of those. Somebody has to go around and inspect them, so I'm sure Angela's very busy. So I just want to put that out there, that you don't sit on your laurels around here, so this shows
No.
it. This is good.
and I didn't know if we wanted to put the needle disposal program under, community health services or not. That was my question.
What's it on there now?
It's on page 2, at the bottom, needle disposal program, but on the back, we list everything, community health services.
Yeah, that would be good to do.
You know, I don't know if
Yeah,
that would be
okay.
better
Oh.
served there.
Well, because you put it with hazardous waste recycling over by
Yeah,
that.
but I think that's a good point, Joan, and I tried to rework things like that to make the categories make more sense, so I like that idea.
So would you want to move hazardous waste as well, where that's a community?
Well, maybe we make a waste disposal category.
Yeah,
Oh, that's,
That's right.
yeah.
That'll put on hazardous waste.
right, okay. I think those are all my brainstorms. Anything else you can think of?
No, I didn't even think of that. I just amazed at the services that we have. for
Well,
the
you know
town.
why? Because we do such a good job that nobody has to call us out for something
it's
that we
amazing.
didn't do. I mean,
And there's so much more that's not on paper, is what's,
Yeah.
you know.
Yeah.
Thank you, that was great to go.
Thank you, and everybody contributes to that.
Yes, okay.
With
Okay.
changes.
I make a
Make-
motion, do we make the changes in our annual report?
Before we do that, do we put anywhere in here our partnership with, like, Moderna and,
They're included as a license, right, Jen?
oh, they're included as a
Yes.
license?
Listed as one of those
Okay.
941 permits.
Okay, all right.
We have 2 fire techs?
Yes.
Yeah, and that, to your point, that not everything can be reflected in here,
Yeah, yeah,
such as a new
No, I
business like
just-
that.
yeah.
That would be under biotechnology, right?
Yes.
Yeah,
okay,
okay.
that's fine.
Yeah.
Okay,
Oh, yeah, I see it, okay.
so I second your motion, Carolyn.
Thank you, Mrs. Bishop.
Okay, all in favor?
Aye.
Motion carried
Approved, thank you.
unanimously. Okay, now onto the nurses' report. Have any questions on that?
So we still have we had 26 influenza, so we're still pretty,
Yeah, I
Up
did
there
wanna
as
talk
far
about
as-
that, from what I understand, we haven't reached our peak yet. I talked to somebody at, in Boston, and they said that we have not reached our peak, and it's still going strong, and there's still quite a bit, and they said it's not too late to get your flu shot, where we haven't reached our peak, and the flu is particularly nasty as last year's was. And we have more deaths this year than we did last year.
Yes, we tragically had those 2 children pass,
Yes,
which
Were they
exceeds
inoculated?
last year. I think we just had one.
Yes.
last year.
they were both
Both
inoculated.
inoculated.
We have seen increased activity, which we usually see this time of year.
Mm-hmm.
We do chart it, we look at it, and I should have printed that graph out, I apologize. Every Monday, the state comes out with the data on activity. And, yeah, it has the peak is still climbing.
It's still
did they
climbing.
both pass from flu?
Flu
or
related.
Flu related, okay.
And it's hard to tell. I mean, your kids are spiking temps a lot, not a lot, but often enough so that you don't really get crazy about it, and that's basically what happened.
So I know that we get reports from the doctor's office, if, I brought somebody brought to the doctor's office and they say, I had the flu, that report comes here. But in the schools, in the elementary schools, when somebody contracts the flu, and the parent, do they call the nurse at the school, and then we get that information, because I heard there was quite a few.
No, so with the.
So we don't
there's-
track
There's
that at
2
all.
sets of data that the state collects that kind of funnel down to us. There's actual lab testing, so when people get tested for influenza, there's a lab test and that gets reported to us, and that's what reflects in Karen's report. There's also influenza-like illness, and doctors' offices report that to the state, and that's what we look at in the chart. I don't think we have a local statistic of influenza.
So we don't have any direct contact with the nurse that they'll call us once a week and say, Peggy Sue was out with the flu.
No,
2
and there's
from the
no,
Oldham, 3 from the Cleveland, no.
there's no real need for us to have that
Okay.
information. What we need is the big picture. Yes, flu is peaking, we put our prevention methods out, wash your hands, stay home when you're sick, cover your cough. And the schools are putting out their messages, stay home, if you have a fever, and right now, it's just about control and putting out information.
So when somebody goes to their pediatrician, they become positive for the flu, that report goes right to the state?
Correct, there's an online
So then we
reporting
get it
system.
back?
Yes.
Okay,
So
so it's a
those lab
cycle.
confirmed cases,
Yep.
we do know, and that's,
All right.
again,
But we
the
don't get
26
names
here.
or anything.
Oh, no,
because
I
of
don't
that
mean names,
HIPAA
I
laws,
just
yeah.
want to make sure that we can track that as,
It's actually a very good question, because back during H1N1, the nurses did do that at each of the schools. They
Yeah.
kept track of who came down with influenza-like illness and reported it to us, just so we knew
well,
what was going
preventatively,
on
I
in the
think that
schools.
there's a little something we could do, actually, we can, hose them down, the school, we can do more stuff.
Yeah.
And we're grateful that vacation's next week because of an increase in the flu. They can, take down the school, sanitize it, open the windows, so every once in a while, that's not a bad thing. I mean, that's why I just want to track it a little bit closer if it becomes an impact in the elementary schools. Thank you.
Okay, any other questions? Nope.
And I never remember these things growing up. I mean, I just don't remember the activity of this. Like,
A flu?
yeah, no, just tracking it and,
Well, we definitely have better systems to track it and diagnose, for sure. Which helps us in our efforts.
Yeah.
of course it
Absolutely.
does.
Well, every admission to the hospital, whether it be pediatric or adult, get tested for flu,
Oh,
even if
okay.
they've had the flu shot. Oh, yeah. Yeah, they get a nasal swab to make sure, if they
We're
have,
testing more, too.
yeah. So we are testing more, and it's, you know, even employees, people, there've been employees at Norwood that got the flu even though they had the flu shot, so, you know.
But we do wanna stress you probably get it more mild.
You get a
Oh,
milder
yes,
case.
much more
It
mild,
does-
yeah.
You know, it doesn't guarantee you're not gonna get the flu, but you,
Right.
if you do, it'll probably be more mild if you've been vaccinated.
Thank
Okay.
you.
Drug-free communities grant and impact Norwood report.
So like I said, Aubrey's actually at the high school right now, but I can answer any questions about her report. She did just get back all last week. Her and Paul Murphy, school resource officer, were at the CADCA conference in DC. They
Okay.
got to meet the Surgeon General and. they
Oh,
had a very good time.
nice, nice. And they got their graduation?
Yep, they graduated
Certificate?
from the National, the CADCA Academy, which is a requirement of the grant actually to send 2 people through that academy program in your first year.
That's great. So,
All this comes out of the grant?
Yes.
That's wonderful.
well, that's good. You know, that was nice of Paul Murphy to, you know, to be involved in that. And it's not something he had to do, it was something he volunteered to do. And Aubrey, you know, has been good now. How many, she's here for 10 years if we keep getting the grant?
So we're in year 2 of the grant. It's, we have to apply between years 5 and 6, but you can have the grant for a total of 10 years, and then you can't apply anymore after the 10 years.
Okay. All right.
It's important to have grants available and have them in our possession, so because of what's happening with the town, that I want the town to know, townspeople, that this money does not come out of anybody's budget. That this is money that
We
we
got from
worked
them.
hard and Aubrey have to receive the grant. It's
And-
important to me for the townspeople to know that.
Yes, but I also would want to put a caveat on that after the 10 years, we don't want the program to end.
No,
Right.
So part of the grant actually requires you to come up with a sustainability plan. And whether we look at, you know, transferring to a nonprofit or town funded
We
or
can do
some
that.
donation funded, so we still want to be able to continue the program after the 10 years. And especially in years 6 through 10, we will be developing some sort of plan for funding beyond those 10 years.
Yeah, that's great. And it says that in the next few weeks, Impact Norwood will have a preliminary results from the 2018 Youth Risk Behavioral Survey. So we have some idea of which way the wind is blowing with the kids, and, you know, where we have to step up and, okay. That's good. Okay, and the next meeting is on Thursday, Valentine's Day, from 3 to 4 at the high school library. If anybody has a hankering to get involved in this Impact Norwood group, they're a great group, a lot of fun, but they do get a lot of good things done. Did you want to talk about the Teen Brain speaker?
Yeah, so the last of 3 speakers as part of the Demystifying the Teen Brain speaker series will be presenting on March 14th, 6:30 to 8:30 at the Coakley Middle School Auditorium. Her name is Maureen DeMilla, and she'll be talking about signs and symptoms of trauma due to factors such as substance misuse, bullying, sexual abuse, physical assault, improper use of technology, and cyberbullying. So we really encourage parents to come. Like I said, it's the 3rd of our speaker series.
Have they been well attended?
Yes, the second one was but the first one was a little low in our numbers. We were a little disappointed. We did a big push. We did registration. We provided childcare and food for the second one. So we will do that again for the 3rd one too. So light dinner included, childcare available.
Wow, that's nice.
Hope somebody else brings their kid. It was just my kid in there. But we had 2 great volunteer babysitters from the high school. So again, involving youth in our coalition.
Oh,
So that's
great.
a valuable mission of ours. So we'd really encourage parents to take advantage of this free speaker and to come talk and hear them.
Okay, so that's March 14th, which is a what day?
I'm not sure. I think they've been on Thursdays.
I think the other 2 were on Thursdays.
Yes, a Thursday.
Thursday, okay. So Thursday, March 14th, from 6:30 to 8:30. Free light supper and free babysitting. So come along and have a good time and learn some really valuable lessons. Okay, moving right along. Food safety reports.
All right, I have an update on flesh peppers. I did a routine inspection yesterday at the location. It was a pretty compliant inspection with the issues he's had in the past. He continues to have weekly pest control service. I did read last week's report, and the activity has seemed to decrease. So So that's what
Good.
the technician wrote on the report.
Good.
They are, again, continuing to come every week. They're coming this Thursday.
Mm-hmm.
And he's going to send me that report as well. I told him to stay on a weekly schedule with them
Okay,
until the activity further decreases. So,
Thank you, Angelo.
good, good. Yeah, that was a tough one. If
Yeah,
we can
so-
keep that rolling in the right
but there's
direction.
been progress, yeah.
Yeah.
Yesterday, so this is great.
Do you think we need to put them on the list?
If you continue to send me the reports, pest control reports, I can update the report
Okay.
for next meeting if you like. And
Okay.
just put the notes in there.
All right, if there's any slacking in
Yeah.
that direction,
Just
then,
throw them on, sure.
See a decline.
yeah, if we
Okay.
see any kind of a decline, then it would be
Absolutely. Will
a
do.
good thing to get them
Okay.
on the list. Okay, then we have the new food establishment list. The Oasis Caribbean Cuisine at 487.5 Washington Street, previously Son of Stephanie's, is open now.
Correct.
Old Mill Grill at 61 Endicott
Mhm.
Street is previously the Le Petit Cafe, is
Mhm.
open now. Grassroots is pending.
What is that?
Oh, Culture and Performance Center.
That is the music performance.
Yes, music
Mhm.
performance
Okay.
space on Endicott Street.
Correct.
Thank
We have a lot
you.
of bands come in.
Bands. Oh, I know where we are. Yeah, yeah, yeah. Okay.
Middlesex Integrative Medicine.
Mm-hmm.
Um,
Don't
You're getting
worry.
down to one of my
Nothing
favorites. I
yet.
wanna know where that is. Go ahead.
Okay, Launch Trampoline Park is transfer of ownership.
Yes, I have an inspection this week for the permitting inspection, for change of ownership.
And Chefin and Tin and
At
Bed-
the
Chef and
cakery. What is
Eden.
that?
Oh, Chefin and Eaton, I get it now.
Yeah.
Chefin and Eaton, huh?
Yeah.
That's clever.
Bakery?
Bakery.
It's gonna be a bakery, correct, yes, they're in the construction phase.
Where is 645?
Right next to where Delish used to be.
Okay,
Oh,
hit me
yeah.
again with
Giorgio's
another
Pizza,
landmark.
Georgio's
Where's
Pizza.
the list?
Pizza down, yeah.
Where?
No,
Right
I missed it.
Downtown, yeah,
Washington.
Washington.
Oh,
Washington.
yeah, 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 yeah.
Oh,
A bakery, just like Gertrude's.
Yeah, I was just gonna say that, yeah.
Gertrude's was an
Gertrude's
old
was an
bakery in town.
old-time bakery.
Couldn't find anything better than that rolled milk bread. It was delicious.
Oh, I know it was.
I don't know, Gertrude.
Yeah.
oh, it's gone before your time.
Yeah.
Oh, that's awesome.
And Melissa's Catering is change of location to Winslow Street. Um,
They're renting the downstairs kitchen from the VFW,
Oh,
Elks, sorry,
no.
from the Elks, yeah, so actually I'm going there for an inspection, I believe this week, to permit her.
Okay, we wanna keep an eye on
Sure.
that. if
She
you
must
could.
do all the catering then out of the Elks for functions if they need it. She must have contracted with them.
I know they're leasing the space out to her
Yeah, it's
to
perfect.
conduct her catering business in their downstairs kitchen, which is rarely used by
yeah.
the Elks, thank you.
Real, the downstairs kitchen.
Correct.
It's a nice kitchen. I worked out of there for
It's a
functions.
pretty big kitchen, they have a little kitchen upstairs where the bar is,
Oh,
which
I don't
they
know where they
mainly
are.
use.
They mainly use that
Yeah,
for
so then-
functions, yeah.
So,
Yeah.
Thank you.
Okay,
so,
yeah, I'd like to keep an eye on
sure.
that, if I could. Okay, the food establishment inspection, my favorite. Oh. Okay, page 1, Olivares.
Yes, so upon my inspection that morning, there was no hot water available at the hand sinks, so they were not open for lunch until the issue was resolved. All prep work had to stop at that time as well. Make a long story short, they did have hot water eventually around 5 p.m. that evening. I was contacted on my cell phone with pictures and videos of the correction they made to have hot water at the hand sinks. So
How
they were
long
allowed-
do you think they went without hot
Yeah, I
water?
was just gonna ask
I-
that question.
They don't know.
Well, they know,
So,
but they're
well,
not
they
saying,
tell-
yeah.
they know.
Oh,
Exactly.
So,
okay.
That's what they tell me.
unless, if you hadn't gone in for an inspection, they would not have been, they would still have no hot water.
Correct.
I'd like
Unless they noticed it.
Angela, was this one we discussed, they had 2 tanks, so wasn't.
No,
there any-
those were the 2 tanks for the apartments upstairs, only had 1 tank for the
okay.
restaurant, yes,
Apologies, sorry.
correct, no, but you were right, I thought they had 2 tanks.
Yeah, I'd like to put them on the list.
Okay,
for just because that's,
yeah,
it's
that's
not
pretty
good
egregious,
practice.
that,
I
yeah.
mean,
They have new manager or anything, Angela, that this would be?
Mm-hmm.
Nothing, no.
The chef was there
Uh-huh.
that morning,
But
Yeah.
do they not know that they need hot
Well,
water?
he did develop a checklist for a morning opening checklist, and
Okay.
enhanced things to check the hot water has been included
Okay.
on that checklist.
I'd just like to put them on for at least one more check, just to make
Okay.
sure that they're following that log and,
Well, you know what concerned me about the inspection list is now more and more that these restaurants are starting to, put their containers and whatnot, on the floor rather than on the pallets. And, you know, they know better than that. They know that they can't store things on the floor in the storage room, but, I mean, this wasn't the only restaurant in this report that
Mhm.
was found to have stored things on the floor. I mean, is
And that's a
this,
simple remedy.
a very simple remedy, you know, we do, I know we do a letter every once in a while for paper towels and all that and whatnot. Can we start a list of things that, like, maybe once or twice a year, we send out a letter reminding them that things are not stored?
I
You
think
know.
Angela does a great job of sort of tracking these things, and this is, let me put that on the shelf, what I want to talk about, but, and brings them up at his workshops. So like, he brings up things that he sees in the field and saying, you know, I'm seeing a lot of this in the field and we want to address it. So he does bring it up in the workshops. Another thing, which is sort of a more long-term goal, is we switched to a digital inspection software, ideally in a couple of years, with the town taking on more technology in our accounting. A lot of inspections and permitting will eventually come with that package also. And to be able to track things like this, so how many times do we cite food on the floor? And
Yeah.
we'll actually have data to back that up and say,
Ah.
you know, 20 of our inspections had this violation over the last 2 years. This is something we need to address. So it takes a lot of this information that we kind of remember
Kinda collates
month to
it all.
month,
Yeah,
but it
yeah.
actually tracks it over the years, and we'll have a much better evaluation of what we're doing out in the
Do
field.
we have that?
They're promising me in 2 years about.
Is
So
it-
it's part of the Tyler Munis package that you've been hearing, that our accounting system is the first thing to transfer over. And then eventually it's gonna be permitting and then inspections that goes with that too, for all departments. So it's coming, and I think it'll help with things like that. We will be able to really identify the types of violations we're seeing across all the inspections, and be able to tailor our program to be more effective to address those things, whether it be at the workshop or some sort of communication with the establishments, whether it be a mailing or social media, or however we tailor that.
No, anything that would say, you know, in the last 4 years, you've had these sightings that could just come up, I mean.
And then the flip side of that is, we can also see the improvement, right? So we can
Yes,
see,
of
you know,
course.
if for 3 years we had, you know, this percentage of violations, of certain hand washing violations. And then we can see if Angelo, you know, we tweak the program, we start to address that more, we can start to see a decrease hopefully in
Yeah.
that type of violation. So
Good,
more to come on that hopefully.
okay. And we talked about Orange Leaf, 30 days,
Yes, I'm
gonna
gonna give
talk
them a
them
call this
today.
week to find
Okay.
out if they've been recertified.
Okay. Okay, senior living at Clabber Tree, we have a new person there.
Yes, the person in charge that was there when I was there, she no longer works for the company. I did call them the other day. A new kitchen manager's been assigned to the kitchen. I left him a message on his voicemail yesterday, and I haven't heard back yet, so I will talk to him and make sure that he sends me his certificates, copies of his certificates, to make sure he is certified
Good,
as a food manager.
okay,
I'm going to assume he is, but
yeah.
I'd like to see those certificates.
Cafe Paprika is another one that had onions stored on the floor. Now I'm gonna pick them out because, you know, it's,
Oh, top
Yeah.
page, sorry.
yeah.
Yep.
Okay.
Usually, before our workshops, if I think an establishment needs to send associates to the class, I will give them a call to send people to the class, to the workshops. So Cafe Paprika will be on that list, and have them send me the 2 or 3 staff members they have there, and send them to the class so we can discuss.
That's the workshop that we provide here.
Correct,
Yes.
the free workshops.
Free of charge,
But
right,
the next one is in May, I believe, so, yep.
good, good. Yep.
Yep.
Stop me, guys, if there's something that I,
Where is same old place?
The
yeah,
old Papa John's location?
yeah.
Oh,
across from the
okay,
Shaw's Plaza.
okay. They're a brand new opening, and they already have two violations, two criticals.
The owner was there during the reinspection. We reviewed the violations that were noted from the previous inspection, and they had corrected them on site while I was there. And then I reviewed with the owner as well during the reinspection.
Furlongs is coming along well.
Yes.
Now, when you say prep room in the basement, that's just storage down there, correct?
Let's see here. The prep room is, they have one container of flour that they have in there
Uh-huh.
that they dip their candies into. So it's not really a prep room. They do have outside those two rooms, there is a prep area. There's a little cooking station, there's a hand sink, 3-bay sink, a couple of prep tables that they prep in that area. But those weren't the affected areas. It was the other two rooms that were,
The
that
other
need to
two
be
rooms.
renovated.
Oh, good, good,
I could have used a better word there, but
yeah.
Oh,
it's all storage room.
I'm sure they're happy with Valentine's Day coming, that they're.
Yeah,
Yeah, they needed it, so
Yeah.
she realized that. So.
good. Yeah, their candy is very good too, unfortunately. Okay. Glad to see we only have 1 or 2 paper towel problems. They seem to have corrected that.
Max roast beef is on the,
Oh, yeah.
again. I know it says here, is to treat weekly until the activity decreases. Isn't this something that we frequently have a problem with them?
Yes, yes. That's why I have on the list again.
Yeah,
Mm-hmm.
No sooner do we take them off the list than they're back on the list.
yeah.
They sent me the pest control report for last week that I reviewed yesterday.
Okay.
It doesn't have a lot of information on it, so I will call her back to make sure that the pest control company takes proper notes on those reports.
Yeah,
Okay.
So that's not as detailed as it should be.
Should be.
So
Angelo, do we have a protocol for the pest control companies to follow, or does it depend on the infraction? You know what I mean? Is there something we give the owners to say you need to do this, or is it because of, you know what I'm saying? This infractions are different in each company, I'm sure, each restaurant.
well, there has to be an open line of communication between the restaurant owner, person in charge, and the pest control company or technician. So the pest control company leaves a sighting log for the staff.
Oh, okay.
So anytime you see any activity, whether you see bodies, mice running around, droppings, they have to note that information in the sighting log.
And who does that, the employees?
The employees, correct. Because what
Oh,
happens
see, I
is,
didn't know that.
a lot of times, pest control companies will go into a location before the employees even
There.
are there. So what they'll do first is go to that sighting log and read the notes that the staff have taken on the sighting log for a couple of weeks or that month. And they'll target those areas where they're seeing the activity.
And they get that from the company that's servicing them, that inspection log?
Correct.
Okay.
The sighting log,
I
correct.
didn't know that.
Sometimes the pest control company will email me directly, but sometimes they'll email the owner of the establishment who'll also who'll email me their report as well. So it's email generated. They sometimes don't get it that day. That's usually emailed to them that night or the next day, unfortunately. But there's only one company that handwrites the reports. It's a local company that does that. So
Thank you.
okay. So max
I
roast
like
beef
that.
is on the list.
Yeah.
Okay. Okay.
I know it doesn't show up on some reason on the report, but I believe Max was fined for that blade to the mounted can opener. I believe it was a third.
Mm-hmm.
It was a repeat violation, critical violation, so they were fined, I believe, $50 for that, so. And I did go back for a reinspection
Yeah.
on the 23rd, correct, so.
Okay.
Good.
Page 7, Pizzerina Bruno's, I think should be,
Well, I am going back there for a reinspection on the 28th.
okay.
So that, the updated information will be on the inspection report for next meeting. So,
Okay.
but that leak, that pipe that was leaking under the three-bay sink, he did call me and it was, repaired, I believe on Friday, Thursday or Friday.
Okay,
But I'll double check that when I go in there on the 28th as well.
okay. And the certification with the anti-choke procedures, have we heard from them on that?
No, they were given 30 days.
Yeah.
Yeah, so I'm gonna
To
check,
comply.
yep,
Yeah.
comply, correct.
Okay.
So that'll
on
be
the
checked that
28th,
day,
you'll
correct.
check,
Yep.
okay. Did we want them to go on the list? Oh, he's gonna go back on the 28th anyway.
I think he's going back
Okay.
on the 28th, it'll be okay.
Okay.
Do we have a list of suppliers that give on the anti-choke of businesses? Somebody asked me that last week, now that I brought it up, anti-choke.
We do use a vendor.
Yeah, it's not a long list, it's got one person on it.
Yep.
It is kinda
Is it
hard to
Mrs.
find.
Olson?
Yes.
Still, Beth?
Yeah.
I might like that information.
Um,
I
and
thought
we
the
do-
fire department did it at one time.
There's a
They used
Westwood
to.
firefighter that has,
They used to.
there's a Westwood firefighter that, does classes, I believe, on the
Does he
side.
still do it?
I believe he does.
Yeah.
Yeah.
And it can be a little hard to find just the choke safe, as opposed to like a CPR
CPR.
first aid, you know. the
But
whole-
Beth
I
does,
see.
I know, Beth, she's a
Yeah,
baby.
and we also sort of facilitate it once a year, we give them a room in town hall and,
Yeah.
we
Can I
advertise
have
for our
that number?
food
Right,
vouchers.
it's usually
Yeah, I
in,
can get
in
it to you
August.
after the
Thank you.
Yes.
We try to help them by doing one in August in town hall, where, you know, any Nord, they have to pay for it, but
Yeah.
we sort of help facilitate it, and then they can give us a certificate right there.
And CPR, Norwood Fire used to do CPR too, remember?
Well, they do
I
that for our
certainly do.
employees.
They do it
So
for
we actually
employees,
just had ours, and there's one going on right now, for new certifications for CPR and AED training. So they're very generous in training.
AEDs for her. The nurse.
I don't need an
Oh, you're
AED.
retired. But we don't need AED, do we?
doesn't mean
well,
I'm
like
not
the
a
town
They
nurse.
have them in the town.
So the AEDs in public buildings,
Oh,
Yeah.
yeah, oh, I know what you mean, yeah,
yeah,
uh-huh.
just being trained on how to use that.
Oh,
How to
okay.
use it.
Take them off the wall. and-
Take them off the wall and read the directions. I
Well,
remember.
no, it's nice if you have knowledge of it.
Yeah, in that panicked
Yeah.
scene, you wanna have some training behind you.
Yes.
But I do always say I'm gonna be screaming for Stacy. If it happens. Be looking for an RN. I'll do what I can, but
Yeah.
I'd rather be the one calling 911, have someone else do.
But there's nothing you can do wrong, tell them, Stacy.
No.
No,
Right,
the machine does.
Break a
The
rib.
machine does
The
everything.
machine does it.
Yeah.
It tells you
Yep,
whether
Yeah.
it's a shock available or,
Yeah.
you know, whether
You
it's.
start off with hands only.
yes,
Yeah, so you
So you don't
exactly.
even have to worry about that, and
Yep.
just do it to the
Do it.
song, staying alive.
I had to do it in my old job all the time.
Yeah, you just,
And
Do
then
what it
the
tells
new
you to do.
mannequins, I'm sorry.
just do what it tells you to, that's
Yeah.
all.
For the CPR, the new mannequins actually had lights on them to show that you were making the
Yes.
proper
Oh, that's
depth of
interesting.
compression and
Oh,
proper
very
speed.
helpful.
That's good.
Oh, really?
Yeah, I hadn't seen one with the light on it. That helped.
They do PD?
Yes.
Yeah.
I think that
See,
PD is so important, and
Oh, I do
most, I'd say 99% of the people out here don't know how to do it on a child. You know,
Oh,
it
yeah,
just,
it's a lot different on a
oh,
child.
yeah, yeah. You can do more harm than good sometimes if you,
But you know what, Joan? Anything.
anything
in
is, yeah.
Yeah.
Yeah,
Or something.
if they're in a situation that you, even if you're doing it incorrectly,
Mhm.
not that they advertise that, but at least if you're trying
Right, they
something
temp-
until you get somebody else there
Mm.
that knows what they're doing. There have been, young kids have saved people's lives.
Absolutely.
Because they've watched something on TV on how to do the Heimlich maneuver.
Yeah.
They've
Yeah.
never really been trained, but they actually saved some, you know, there was a young boy recently,
Yeah.
saved somebody that had a,
He watched the episode of The Office.
yeah,
They had done it on an episode of the TV show, and he said that's the only reason why he knew to do it to staying alive was
Wow.
because of a TV show,
yeah.
Oh, isn't that
and he
funny?
saved someone's life.
I mean, it's definitely that you should be trained.
Mhm.
I'm not saying don't be trained, but there are times when people
Yeah.
just watch things on
So you gotta
TV.
keep a copy of Staying Alive somewhere so that you can,
You just gotta keep it in your head.
Love it. Jan.
okay. All right, back to the thing at hand.
Page nine.
Talk about getting distracted.
9.
Nothing, we're on page 9. Okay, Marcia McLean, let's see.
One Investor's Way. Where is One Investor's Way?
Mercer?
Oh, okay.
Where is it?
Mercer.
The Mercer
Old
building?
Polaroid,
Ah,
yeah. Do we need to do anything with that?
That's just an employee.
Correct,
restaurant?
yes, he was spoken to by the kitchen manager before I left, so. And I'll have a copy of this inspection when I go back there next time, so I'll be looking for that for that issue again when I go back.
Okay.
For that routine inspection.
Wow, these people with no paper towels, and it's such a simple fix.
Are we concerned about Victoria's, or you have an inspection coming up on the
I
19th?
do on the
so that's-
19th, I'm going back
okay,
for a re-inspection.
Okay,
And the notes from that re-inspection will be included on
okay.
next month's report.
Okay,
Good job, Angela.
thank
Aaron,
you,
good
Angelo,
job.
again.
Thank you.
You know, yeah, Victoria's is
He has one this week.
coming up, yeah.
Or the
I
beginning of
mean,
next week.
how simple is soap and paper towels? They, you know, if they have a list or a checklist that they can
Mhm.
go through, then, I don't know. And the long beard, yeah, that would skeeve me out. Yeah. Okay. All right. All right, so we'll keep Victoria's on the, she's gonna be done anyway. All right, anybody have anything else they wanna? No?
Thank you.
Nope, thank you.
Alrighty. Moving right along to the director.
So I wanted to focus a lot on my report on sort of, I think it's something we've done and heard about in our periphery, but I wanted to really talk about sort of public health 3.0 and the trend of public health. And really the new direction, which I feel like we have taken here at the health department, but haven't really discussed the reasons why we're doing a lot of the things we're doing, such as coalitions like Impact Norwood and now the Minds Matter coalition, which sort of grew out of that too. So really, you know, again, always based out of research, which we want to use to choose our directions. Looking at the things that really affect your health on a community level, and it comes down to, they call it the social determinants of health, and it's your socioeconomic status, whether it be income, whether it be your education level, your employment, things like that, your physical environment, your housing, your neighborhood you live in, access to food, that really those are the factors that affect your health. So 80% of the factors that affect your health are beyond just the clinical care you get. Let's say at a doctor's in the hospital, it's the environment you're in, it's your circumstances in your life. And it's those things that affect, you know, whether you get sick or not, death, life expectancy, health status, functional limitations, all those things are affected by these social determinants of health is what they're labeled as. So as a public health department, we want to look at how we can improve those social determinants of health to improve the overall health of the community. And that is a lot harder task than enforcing a regulation, because it takes things like a community coalition. It takes things beyond just the general sort of standard public health things that we've been doing for years. And what I really like, I think, and I apologize, I did give you a lot of information, but there's a great timeline here. They talk about the Public Health 3.0, the timeline. You have kind of Public Health 1.0, which is what we think is, you know, where public health really started to grow in the late 1800s, when we talked about really controlling communicable disease and sanitation issues, where we talk about clean water supplies, sewer systems, like things like that, where we made tremendous leaps, vaccinations, things like that, we made tremendous leaps in public health. Then we kind of think of public health, you know, 2.0, which is really where, you know, I started in public health, and you start to think about government agencies and enforcing regulations, and we've done a lot of that here. And then sort of recently, this new Public Health 3.0, where it's really engaging community partners and multi-sector or coalitions to address those social determinants of health. And that's how we're going to move the dial on a lot of these chronic diseases, whether it be substance use disorders or heart disease or obesity. To really move the dial on those type of illnesses, you need those community collaborations. And really, they also, you know, health and all policy, it's called, that the policies we develop as a community, how is it going to affect your health? Whether we're looking at open space or, you know, other planning and development in town, how is that going to affect your health? And we have gotten very involved in that, whether we talk about the asphalt plant and how we got involved in that, how we get involved with walking programs. So those are the things that are going to move the dial and really improve life expectancy and health outcomes in the community. So I feel like we've been doing a lot of it, but we never really talked about the why we're doing it. So I know I included a lot of information here, but I wanted the board to sort of
Good late night
understand the
reading.
latest technology.
Yeah.
Do we take a step with all of them? Do we start with one and really focus in? I mean, I'm concerned, oh, can I, sorry, sorry, I'm gonna go right in. Are you done?
Yeah.
Okay. So this neighborhood health, I think before I was on the board, I asked Stacy at one point, communities, neighborhoods that have had several deaths in the area due to cancer, brain cancer, certain other things that take your life. How do we go about seeing if there's something that is not working well in that area or was once before not working?
So the cancer
Remember that,
question is always
Stacey?
difficult. So a lot of the risk factors for cancer we don't know about, and particularly you brought up brain cancer. We don't know the risk factors for brain cancer, and it's always very tragic, especially if you see more than a few
So
cases.
3 in the neighborhood, somebody brought up. It's been brought up to me many, many times. So so it has to be consecutive, 3 brain cancers, not 2 lungs and 1 brain.
Correct, because
Oh,
all those
God.
will have different risk factors. There's
Okay.
environmental factors, there's genetic factors, and a lot of those social determinants of health will affect cancer rates. So when we get that question a lot too, and it's always very difficult because it's usually very emotional and someone is affected by
Yeah,
cancer, which
they're
is a
looking
horrible
for
disease.
answers, and they asked me, and I said, I don't know, I'll ask.
You think of the Woburn case. You think of leukemia cases
course.
in Woburn. What's the movie?
I wanna be Erin Brockovich.
Erin
Yeah,
Brockovich. No, those were very specific cases linked to environmental factors. Those are actually very rare that you were able to create
Rare.
that link.
Okay.
It's more going to be general air quality. It's more going to be your genetic factors.
What
it's
we
gonna
built
be,
on
it's going to
sites,
be
I
a
mean, people say
convoluted amount.
if we built on a gas station, is there an old gas station and you build a housing complex on there?
It's very rare that you'll be able to create that direct link.
Okay.
It might be a factor that contributed,
Okay.
but to actually have that direct link where you can create a lawsuit on it and you know that this activity created this cancer cluster.
Because I find that very interesting, and when this one particular person asked me, are you the public health, I didn't know how to answer her. I said, yeah, I will ask that question, we'll discuss it.
And one thing we do, it actually came out after the board folders went out, we did get the Mass Cancer Registry, which we get annually, their report on any statistically significant cancers that they've seen higher or lower than expected in Norwood. So I actually will be presenting that next month. But we do see cancers overall throughout the whole community where we see higher than expected rates. And we will be addressing those. And the ones that we have risk factors that we can address, we do. The big one I always talk about is lung cancer. We know the 2 highest risk indicators for our highest,
Secondhand smoke?
yes, smoking and radon. Highest causes, excuse me, that's the word I was looking for. Are smoking and radon, where we do a lot of work on those things. But the point with this discussion is, yeah, we offer certificates for radon and we try to push information out there, but how can we really involve the community in a targeted program to help reduce exposure to radon or
Good to know.
tobacco?
It's very difficult to do, Carolyn, only because the neighborhood is so fluid. In other words, Aunt Millie had brain cancer,
Well, yeah.
and she was living with Cousin Ralph, and she died. Cousin Ralph decided he doesn't want to live there anymore, so he moves away, and somebody else moves in. That person moves in, and we don't know, if they had brain cancer when they moved in, or they, it's
No,
it's a
I
really-
understand that, I just
Yeah.
didn't know if we took it by a community, an area, 2 streets, do you engulf in a mile radius of one another? It was just something that,
Well, if they do believe there's truly a cancer cluster, we can ask the state to do, to look into it. And they do a study,
That's-
an
that's-
epidemiological
yeah.
study, but it would have to be higher than expected rates of a single type of cancer,
and that's what
with a
said,
possible exposure to something.
one single type of
But like I said,
You know,
we
what
usually
caused
are
it,
pretty-
why did they have that exposure? Was there a chemical plant underneath their vegetable garden or something like that?
And there's not one company in town that the emissions are toxic to inhale in Norwood.
Yes, I mean, we have tons of point source, they're called point source pollutions, that would be they sit in one point and they emit pollution. They're regulated by the state and by the federal government, and they can only emit certain types of pollution. You think about the highway, that's plenty, so there's plenty of air pollution sources around us. It's not like we live in a environment.
But I
Our
mean,
soil
it's
is very contaminated just because
Yeah, I
the
mean, I
industrial
love to see the
history
way
of
we're
Norwood.
going, and so I'm asking this. To me, this is public health. This is public health to me, and this is where I'd love to take this board, that this is very interesting, and there's a lot of knowledge that we need to tap on to make sure that our community is safe.
And that's where you get to example,
No? Yes.
yes, the social
Yes.
determinants of health.
Yeah.
So like your neighborhood plays a key role. If you live closer to a point source pollution, which do tend to be the more poorer neighborhoods, then you will have a higher exposure to poor air quality.
It's like the tannery where they built that
No, you know, and
monstrosity over there, and that, now where they're building all those new apartments down there on Lennox Street. You know, there was a bookbinding, printing press down there, and I mean, they had certainly had a lot of, chemicals and whatnot down there, you know, do you keep track of who gets what kind of cancer in the next 20 or 30 years?
right. I
Well-
think it's just something we have to look at as a community, not just the Board of Health, you know, everybody that's involved in, it's our job, public health is the oath we take. But there is so much more to the community that can help us with the input.
Exactly, that's the point.
Yeah.
It's a community-wide.
It's a community.
We can be the drivers and we can bring
I'd
up
love
the
to be the
topics
driver.
and bring people together, but to address any of these, we need that community involvement.
Yes.
We need those coalitions and we need to sort of be that chief health strategist and understanding that, yeah, when we're developing a housing complex, we need to look at the environmental factors. Not only, you know, what might be in the soil, which we have, is very regulated under the waste site cleanup 21E program at the state, but also how does that affect pedestrian access? How does that affect access to food? How does that affect the community as a whole and the neighborhood as a whole? Can we make it more walkable? Can we encourage more physical activity? So looking at things like development and how does it affect health? And that's what really public health treatment
And
is
we have
about.
proactive.
So this big complex that's being built across the street, well, Plimpton Press, they had to have soil testing and everything
Yes, of
done
course.
prior to even being able to build anything on that,
Yeah.
correct? Okay.
And
people to
because
know
we're,
that.
we have an
Oh,
open,
yeah.
open phone line to all the buildings that we have monitored in the past and changed their systems for the emissions that have worked well, that is a big part of it also, that people, we are available to the public. Our hotlines, our lines, you know, our numbers are available to them if they feel, like what happened with the meatball factory. I mean,
Right.
we took that on and we changed that. And to me, that's a huge accomplishment for public health. And
we
we're
did
gonna
the
do that with,
asphalt-
we're doing that with the asphalt
The
plant now.
asphalt factory as well.
But we only can do that with the public's help.
But so I would take that one step further and be with industry coming to town, which we need. I completely
I understand
understand it. But looking at it through a public health lens and saying, is this the type of industry we want? Does this improve the quality of health in our community?
Yes.
And saying, you know, do we need manufacturing that creates another point source pollution, or do we want something that improves the environment? So understanding that play and looking at it more on that policy level. The hotlines and taking complaints in is something we still have to do, and that's a little bit more of regulation enforcement. But also looking at the big picture and the direction we want the community to go with the lens of public health.
Yeah.
And understanding that it's not always going to go our way,
No.
and you know, but we will continue to implement the idea of how, with each decision a community makes, how is the health affected positively or negatively, and understanding those costs and benefits of every decisions. So that's kind of where I see us going to, and it needs that community involvement.
So in that vein, when we do bring in more industries or whatever to the town, is there somebody from the public health that sits on, or from the Board of Health that sits on those meetings to actually get that information?
So we are in a process now working with MAPC with the 7 communities of NC, well now we're 8 actually. We just added Walpole into our group of you've heard me talk about NC7. There were 7 communities in the region that worked together on grants and emergency preparedness. And now we've added Walpole. But we are working with MAPC to assist the health departments in how to provide better comment to planning departments. Because we do get informed of it, but a lot of it, like that subdivision review we did a couple months back, there wasn't much for us to comment. So we want to be able to help planning by creating better, more substantial comments to give them with the public health lens.
MAPC.
Metropolitan Area Planning Council.
Oh, right.
And so they speak the planner language, and a lot of it is you're learning a whole new language.
Language,
Whether we're
right.
talking, you know, engineer, planning, economic development, that's not our expertise, but we can allow the public health expertise to what they're doing. And also how we can collaborate, that I wanna make it easier for our planner, not add more work for them. So
Right,
how can we have
right.
constructive comments?
Right.
Yeah.
I think that I felt that way initially, immediately when we went to visit Modena. I felt that the questions that we asked them and they answered properly back, that I was proud that they were part of our community and they were up to our standard of public health. That was first on my list, right, everybody?
Yeah,
Yeah.
I wanted to go
I
out and buy stock.
I felt because we as a board went up there and as an organization or for the town, that put us a step in this direction. Let them know that we're here in this town and we require you to hold up your end of the bargain, the taxes, we gave you that permission to have that company in here and to comply with what we asked you
Well,
to
it
do.
gave us a good set of tools, in other
Yeah, they were
words,
great.
something that we hadn't seen or done
Yeah,
before, and,
didn't you think
know, I thought that the knowledge that we gained from that trip
Yeah, I
was,
did too.
was well worth the
But
trip.
connected, because
Yeah.
they were complying with what
Right.
we want in public health.
Yeah, so, that was a good thing.
Because people still ask. I mean, I don't know why they ask me, where do you two go? The people don't ask you. You know.
But they asked, we have the answers, Carol.
Yeah, right, I just say, I'll
Not
call
really.
Cigar, or
Because
I'll
they
call
ask
Stacy.
the other
Or I'll
half
call
of
you.
me.
Yeah, yeah.
They don't ask me.
No, everybody asks me everything.
Oh,
But
God.
thank you,
and-
Cigar, I'm ready to take that step with you.
Great, and I mean, yeah, the boards are definitely the champions out there in the community,
Absolutely.
you know, expressing what public health and the importance of it and how we can all work together.
Well, that's our interest, that's why we're involved in
I'm ready.
being on the Board of Health and stuff like that, and that reminds me, did you take out your papers? Was it, yeah, you're up, right?
Yes,
And
Yeah.
she turned them in.
yes.
And you turned them in? Oh,
Yes.
good, I was
She's
gonna
officially
ask you
on the
where my
ballot.
beer ones are. Okay,
Oh, I did have it.
okay.
I'm sorry.
I don't have that
February
paper.
first. No,
Yeah, you
I-
do, I was looking at it.
No, because it comes out on Monday.
No, because
and your
I was
board
looking on your shoulder, I didn't see it.
Why didn't I have this Monday? So this was last week, so I apologize. So, just real
Jenny's
quick,
got it.
I know.
I had one.
So the red line is this year, the blue line, is last year. You see that huge spike where we did see a lot of flu activity.
Uh-huh.
So, and I think this week it also climbed. We don't wanna reach that huge peak, because that was.
We
last
don't
year
wanna
was bad,
reach
but
5.5, no.
We are higher than we were 2 years ago.
You don't like that.
Yeah, so.
Yeah.
And that's influenza-like illness.
Do you think that has any correlation to the vaccine? I think the vaccine.
I think that's definitely a factor.
Yeah.
The effectiveness
I mean,
of
it's
the
a
vaccine.
guess every year on what they include in the vaccine. I mean, it's, you know, it's supposed to be an educated guess. Well, it depends on who you talk to and who you're educated. But, you know, I would like to think they do the best with what they have, and it's not just one person that says, yeah, I think I'll take a couple H1N1s and a couple, you know,
Well, I think
yeah,
so.
yeah.
But, yeah, and I know they're working on trying to be able to manufacture the vaccine faster.
Yeah.
Because the problem is they have to start, what, years?
A year, yeah, basically
A year before it's even here, and try to determine which strains it's gonna be and how well they can match it.
Well, I'm so happy that this strain was more compatible with the public, because last year we took a lot of heat. That it was, why did I have that shot and it was 40%?
Well, if it still
Yeah.
keeps climbing, we might take more heat, but,
Yeah.
Yeah.
I mean, it's still the best way to protect yourself
Yes, it
against the
is.
flu is to get
Yeah.
vaccinated.
No, but I mean, you can see 2016 and 17, you know, how it only reached 2.5, but, you know, the following year it reached
Jumped.
5.5. Yeah, so, you know, it just, as I said, I just think it's a good guess. That's what they, you know, go by from the year before. So let's hope that it stays at 3.0. But it's a little higher, you think, this week?
This week, I'd have to look at it, but I think it continues to rise. And you usually see that first spike and then a second spike.
Okay, well, everybody out there, wash your hands, stay
Right,
away from
Frank,
anybody
there
that's
he is.
coughing and hacking, and, you know, that's all you can do. Just when you go to the supermarket and you see those little containers with the little cloths to tell you to wipe the handles, wipe those suckers down, and, yeah. You know, you do everything that you possibly can, and if it's in the works, then you're gonna get it. There's nothing you can do about it.
If you're sick, stay home.
Yeah, and if you are sick, stay home, that's right. So it says, it's defined by a
Take your
fever of,
Tylenol and push the fluids.
yeah, it's defined by a fever over 100, and with either an addition of a cough or a sore throat or anything like that. Body aches, Anyway,
I recently visited two Boston hospitals recently, like the last 2 weeks, and everybody was masked. I mean, everybody was masked.
yeah,
And I washed my hands and left the bathroom using more knees, more hips, more shoulders. And that is a way to do it too. I
Yeah.
mean, you just have to have common sense.
right,
Hand washing, take that paper towel and open that door with it. Or lift your shirt and open your door with it if you're concerned.
yeah,
It's just no harm,
yeah.
right?
Right. Even though the person behind you looks at you a little
Too
strange, yeah. No, but that's good. Okay, that's it for the director's report?
Yes, thank you.
Thank you,
Okay,
Sagal.
how about
I
assistant
love it.
director? We got anything?
No,
No,
that's
you're
it.
all set?
I have
no?
one.
Good, because I have one too.
Okay, I have a question with all the recent weather we've had, good weather. Is we have any complaints from the asphalt company?
no, we have not.
Excellent,
That's
thank
Or the
you.
meatball?
I wanna
Huh?
say,
Or the
yeah,
meatball
it's
thing?
been a while, no.
Well, I
We
wondered
had-
about asphalt, what, we had a 60-day, sometime you open your windows and you get that smell permeates from, I'm trying to determine if it's good weather, cold weather, but great, thank you.
Yeah, Home Market
Meatballs.
Foods months ago, and, you know, whiffing the breeze, I guess you'd say. And then I think at one point, there was an issue with the plant. So the person who called did the right thing, and she discovered that there was an issue with the plant that she
Meatball
fixed.
thing,
Yeah.
yay.
Well, and there again, we need the public's help. If you find something that isn't right, call us. That's what we're here for.
Public health.
You know, if we
reports,
don't know about it, there's nothing we can do about it. But if you let us know, then there's something that we can do about it.
Yeah.
Like, somebody that called and said that they could, you know, smell something from we call it the meatball factory, but it's the,
Home Market
Home
Foods.
Market
home
Foods.
market foods.
They make more
And
than
I know, but anyway, if you do smell something and it turned out to be something that they didn't know about until somebody, you know, made the call and said, listen, I can smell this, and they went and checked, and sure enough, there was a problem, and they you know, fixed it right away. So there again, if you're out there and there's something wrong, it doesn't have to be meatballs, it can be asphalt, it can be anything that you don't think is proper for the town, then give us a call, and if there's anything that we can do about it, then we're more than happy to do about it. That's why we're here. Did you say you had something?
No, that was it.
Oh, that was it.
Thank you so much.
Kathy?
No, I'm good. We
Okay.
already talked about
I
it.
just wanted to
John
remind
Drive.
people that we talked about curbside recycling on Tom Cummings' show, and when you got your time calendar, that is, you know, you stick on your refrigerator to know which is the weeks you put out 2 or weeks you put out 1. You should have gotten one of these also magnetic slips that is the curbside recycling guide, and it tells you what to put out and what not to put out. And we talked about it with Stacy, and the main thing you want to really understand is if there is any question in your mind about whether it goes in the yellow or the green, throw it out. Don't take the chance, just throw it out in your regular trash, and, you know, maybe you could ask somebody after that, or
When in
take a
doubt,
look.
throw out. That's
That's
what
right,
sticks in
when
my
in
head,
doubt,
what
throw it
Stacy
out.
said.
So,
Which I
Um,
stole from someone else. Someone
yeah.
else came
Oh,
up.
Stacy, take the credit.
I'm not gonna take the credit.
No,
I
but-
washed things and I said, when in doubt,
Maybe Tom Maloney,
throw out.
somebody,
Yeah.
somebody came
Even
up
though
with
somebody
that.
else goes
Yeah.
through the recycling and said it doesn't belong here, it belongs over
Yeah.
It's a food safety slogan. So when you're in doubt with your leftovers,
That's
like you've
right,
had them in
there
the
you
fridge
go.
too long, throw them out.
Throw
Yeah,
them
yeah.
out,
Throw them
exactly.
out.
So we can use it multiple.
I'll give it to the dog, yeah.
Oh, jeez, the poor dog.
Well, they
I think that enlightened me more,
roadkill and
Stacy,
stuff,
than
and
anything,
then
rinsing out
walking
cans and everything, but,
Anyway, so I just wanted to remind people, because that also is the savings for the town. If we don't get a lot of garbage in the recycling, then, you know, we get a higher percentage of money back at the end of the year. So that was my big call for
Thank
today.
you.
Okay. And that's it. I think we're all set.
Do we wanna schedule an April meeting? We have a
Oh.
March meeting.
We have a
Yes.
March meeting. Did you want to schedule it?
Yep.
Would you get my pocketbook for me, Carolyn?
Oh, I'd be happy to, Mrs. Jacob. Mrs. Bishop is no longer employed. I'd like to congratulate Kathy on her retirement.
Yes.
Yay.
I'm still a nurse,
So-
it doesn't mean I'm not.
Oh,
a
yeah.
nurse.
Keep that license.
Oh, yeah. I
You're
keep
our
that
nurse
license.
now.
Yes.
That license will be with me in.
Thank you, Kathy,
Forever.
for what you did at Norwood Hospital all those
Thank
years.
you.
I
Yes.
appreciate everything. Okay, let's do March.
We
12,
have
Board of
We
March.
have
Yes.
March.
12th, Yep.
Not school vacation, kiddies.
Okay, so
So
what,
April school vacation is when?
Usually the
When-
third week, right?
Yeah, it's
So
that
it's
the week of the fifteenth.
the
Yes.
22nd?
Oh, it is?
The week
Because
of the
15th?
15th.
The
Oh,
week
it's
of
the
the
week of the
15th?
15th?
The
it's
school
early.
vacation?
early.
Oh, wow.
That's school vacation.
So can we do the
Okay, so,
23rd?
Fine with me.
okay,
Joni? We're pretty all flexible anyway, if you can.
yeah,
Do,
anytime,
do we mind not doing Tuesdays then?
say it again?
Can we get off, not
Get
do
off
Tuesdays?
Tuesdays?
So I
Yeah.
have that 9 to 10 and I always feel like I'm rushing down here and I want.
All right, today is the, today's the 12th. How about if we do April 8th? That's a Monday.
That's the third week of,
fast.
yeah,
Oh, that's too fast, okay.
Yeah.
And the following week is school vacation.
We could do the 22nd.
22nd, it's Earth Day.
it's Easter Monday.
And it's Easter Monday in Canada.
That's for Canada, yeah.
Oh,
Yeah.
that's fine.
But I like the 10 o'clock
What's
hour.
Easter
I like the
Monday?
10 o'clock hour too.
We do too.
Yes, I like
Okay.
that,
It does make a difference. So we're gonna do the 22nd?
Yep.
if that works.
Okay, April 22nd at 10?
Mhm.
Thank you for that.
Are we sure that's not school vacation?
Yes.
Yes.
Yeah, it's usually the third week, Carolyn.
Good Friday, right, okay.
Yeah.
Oh, I don't know, I thought
Well,
it was
see,
Good
Easter
Friday
is
and
East-
then the vacation.
Well, Easter is the 21st.
Yours.
Ours. Yours is the
Yeah, Good Friday
Mine's
varies,
Gulls is
but,
different.
School vacation is.
28th.
What is
I
it,
don't think
Jen,
Segal has
Jen?
Easter.
No, I was just saying, sometimes Good Friday varies, but
But
school vacation is
Passover's
the
always
third week.
Yeah.
Okay, Segal,
Do we wanna do, May as well?
Sure.
cutting into my time, girls. It's sometime.
Okay, the 20th? Or do we want to go back to earlier in the
No.
month?
20th's good. 10 o'clock?
On the 20th?
Nothing in May.
You got something?
No, not in May.
Okay.
I have nothing in June.
That's Victoria Day in Canada too.
So
They
the
have a lot of,
Joni, are
they
you
have a
moving
lot
to
of
Canada?
holidays, a lot of
Holidays.
yeah. Okay, so that would be June 17th.
Are we doing June already, too?
Well, didn't you say you had something to do in June?
Can
I
we
do
the
have something to
24th?
do
Oh.
in June.
Can we do the 24th instead?
Okay.
The what?
24?
June 24th?
Oh geez, I don't know, that's Saint
Stop
Jean
it.
Baptiste
Quack.
Day in
Now she's
Quebec.
jumped over Quebec.
What do you have, what do
No,
you
I
have, a
got the
Canadian
same,
calendar?
Joni and I doing paperwork, and we got them all, I got them too, I have them all. Joni, I don't know if we'll be able to make that with the Jean Baptiste Day.
Jean
Oh, wait, no, I'm
Baptiste.
sorry, I can't do that.
Oh, my
Mine's
God,
in
you sure?
ink.
So 17th then?
All right, no, maybe I can.
Go back to the 17th?
No, because I can't do the 17th either. Keep it, fine. I'll come in for the morning.
We can change a different, we
We
can
can
do a
change it
different
to a
day
different
that
day.
week if you need. I know Tuesdays is not good for you, but we
How
can
about
change it
Wednesday
to
the
a-
19th?
The 19th would work.
Wednesday the 19th, okay.
Of
I apologize.
June?
Yes. Thank you.
That's
Sorry.
Juneteenth. That's what comes up on my, Juneteenth.
Juneteenth, okay, so I gotta.
And we're sticking with all of them at 10 o'clock.
Okay, so Saint
Yeah,
Jean
that-
Baptiste is safe.
Free for us.
For right
All right.
now, it works for me.
Okay,
I
that's,
could not have gotten here this morning. Takes me an hour.
Oh, I bet.
Oh, my God.
okay,
So when are you gonna get out of that torture chamber?
can I,
Okay, you wanna, somebody
I'll
make
make a motion to
Okay,
conclude the meeting.
I second that, thank you.
all in favor?
Thank you.
Aye.
Aye.
Okay, thank you very much, enjoy the day.
Thank you.